So, Teresa, this is the first time we've seen you,
Yes.
and you're a very nice young lady, and so we'd like to talk to you about your knees. And
Okay.
you like to run,
I do.
and you're getting ready for a marathon,
I am.
and you've been running for about 2 to 3 years,
Mhm.
and you love running,
I do.
and I'm a runner also. And so you started to develop some kneecap pain,
Yes.
didn't you?
Yes. About 5 weeks into my training.
Right, and now that pain has translated to where you're having pain with stairs
Yes.
and squatting,
Yes.
and you can't do Zumba dancing,
No.
and it's really started to affect
Right.
what's going on.
Right.
And I have to find a magic wand to get you back running again.
Right.
And I told you, you have the most frequent cause of knee pain.
Yes.
It's absolutely number one. And every day in clinic, we will see many, many patients that have your problem, and it's called Chondromalacia. And did you do some work on the internet on Chondromalacia?
I did. I've been on your website. I've been on multiple websites.
That's good.
Yeah.
And they probably described it as it actually is an early form of arthritis.
Mm-hmm.
It's where that very delicate lining behind the kneecap starts to actually crack.
Mm-hmm.
And you're where you have some cracking
Right.
in both knees.
Right.
And it's interesting, a lot of patients will say, well, in the past 5 years, I've started to develop cracking with squatting or lunges,
Mm-hmm.
and that's kind of important. Everyone's knee cracks. I don't think I ever see a normal knee that doesn't crack. So we don't want to make our patients too sensitive about the cracking, but we're looking for that real grinding cracking. And fortunately, you don't have that.
Mm-hmm.
So that's a good sign.
Mm-hmm.
But you still do have some cracking in your kneecap.
Mm-hmm.
And then you develop some tenderness
Yes.
around your joint,
Yes.
didn't you?
Yes, I have.
Right. And so and you really can't really run now. You were running about 25 miles a week, which is not too bad.
Right.
But you started to get into a problem where actually if we kept you running at that point, you're not going to get better.
Right.
Right. So we've had to kind of say we've got to really work on this.
Mm-hmm.
You're in the acute phase,
Mm-hmm.
which means you've got inflammation in your tissues. And we kind of said that's just like having a cavity in a tooth.
Right.
So that chondromalacia is like a cavity in your tooth, and the irritation of your tissues around your kneecap, we always say it's kind of like the gum around a tooth.
Mm-hmm.
So all of that is inflamed, and so we don't want that, you said it correctly, we don't want that to be a chronic problem.
Right.
We want to treat the acute problem, use our exercises, back you down a little bit, and you're going to kind of do a run walk,
Right. I'm going
right?
to take myself down a little.
And we're going to hope over the next 2 to 3 weeks that we see some benefit from that. Now, if we don't, we're going to have to back down further.
Mm-hmm.
And we appreciate as a runner, we never like runners to stop running, but sometimes we have to substitute other activities like an ellipse.
Mm-hmm.
And you're here in Cincinnati, we have hills, and you're running on asphalt, and all of
Right.
that is very bad to the
Right.
knee. Now, we also told you that you have a kneecap that kind of floats, and if we can go to your knee, her knee, that kneecap, and I don't want to hurt her too much. You can see she's hesitating right now. She's got tenderness around the outside tissues, so that's a little inflammation that we have, and then your kneecap floats back and forth, and that's very common to have a floating kneecap. And then you also have some tenderness in your iliotibial band over here.
Yes.
So we start off with a knee that has lots of little parts in it, and so you actually have kind of a long diagnosis. You've got chondromalacia of your patella, you've got a tendency for your kneecap to float, and we're going to try to treat that with exercises, and then you have inflammation in your soft tissues, and we're going to use some very mild anti-inflammatory medications. But as you said, we're not going to keep you on that very long, because we want to kind of come on that and come off of that. And then we may have to use a knee brace.
Mm-hmm.
And so overall, if you put in, it may take you 2 or 3 months
Mm-hmm.
before you really start getting back to where you were. But I'm glad we saw you today, because a lot of times the mistake would be to just keep running on it and running on it.
Mm-hmm.
And I see many patients that the inflammation is twice as bad as yours.
Right.
And you have fluid in the knee, and you really are decompensated. And inside the knee, it gets all red,
Mm-hmm.
and it gets inflamed. And there's an old rule that for every week that you have symptoms of a knee, it takes 2 to 3 weeks for you to get better. What do you think of that rule? That's not a good rule.
Well, no. It's a little disconcerting, but
Yes.
I'd rather be here for this consult than a surgery consult.
That's
so.
right, and we're going to do everything. I don't think you're a surgical candidate. I think that we can work very nicely through these non-operative things. There's another rule that we've had with runners for a long time. It's a general rule, but it says that when you get a runner going back, you add about a block a week to the running, and that's maybe a little too conservative. But that was an old rule that many doctors remember. And what that says is that when you get back, you're going to have to really be a smart athlete and look for any pain or look for any swelling and kind of back it down. And of course, there are some things you can do to stay in condition. We want you doing exercises. You can do strengthening exercises. We're going to have a whole roll of exercises for your quadriceps to help balance the kneecap. And we're going to have you do that cautiously. We're going to tell you that if you have any pain doing that, you want your therapist to know, because we really don't want to irritate the joint. I have many patients that start out in therapy, and the therapy is too vigorous, and they stop it, and they say, that wasn't a good fix for me. I'm just making my knee worse. So sometimes we have to be very, very cautious when we get back. But overall, I would give you about a 75 to 85% chance. My crystal ball sometimes isn't real clear, but I think that you've been doing this for a couple years, and I think we can get you back to what you're doing.
That's what I wanted to hear.
Okay, very good. Thank you for talking to us, and we'll use this as a patient educational video on some of the initial things that we do to keep you going.
Thank you.
Very good. Thank you very much.